Hello, everyone, and good evening. Welcome to a new podcast in Be Ready Emergency Medicine. I'm Dr. Fahad Al Haddad, Emergency Medicine Specialist, and today we are going to speak about one of the most interesting topics in the emergency departments, and it's very important for all the providers and doctors, nurses in the emergency department. We are going to speak about pain management. Mainly, we are going to speak about pain management out of the box a little bit, like we are going to speak about a new agent or all the new agent, which is the magnesium sulfate and its role in the pain management at the emergency department. So we are going to speak about the pain, and the pain is one of the most common concerns of patients to the ED, and achieving the excellent analgesia while minimizing the side effect. It's an important and very important skill to develop all the time. So the goal in the emergency department for pain management is not to resolve completely the pain, but to reduce it and to be acceptable level, allowing for safe discharge or return to daily activities, or to be tolerate the pain. Let the patient tolerate the pain and let them back to their normal life, and to search for the reason for the pain maybe later on. But our goal is to reduce the pain. So because of that, we are using the pain scale always, which is the numeric pain scale from 1 to 10. It's easy. Need, I think, only some expertise about the facial expression, and also to determine while if this patient is in severe pain or mild pain or moderate pain, and according to that you will prescribe the medication that need for this patient. So the numeric pain scale from 0 to 10 is one of the most accessible measurement for the pain scale and measure in the emergency department. And we need to also to speak about the WHO ladder. It's a very important ladder, the known ladder of analgesia in the emergency department we're using. As the pain is mild, moderate, or severe, we need also to prescribe according to this ladder the medication, as we are using the acetaminophen or the paracetamol as standardized for the mild pain. If we will go up a little bit to the moderate, so we are going maybe to use the NSAIDs. Maybe if it's severe, we are going to use the opioids. If it's totally severe and worst pain ever, we can use strong opioids. So this is very important for us to guide us to prescribe the medication. The importance of the pain ladder of the WHO to prescribe the analgesia in the emergency department. So we are going to speak about our friend, new and old friend, about the magnesium sulfate and its role in the emergency department. If we want to prescribe the drug class, this is an antiarrhythmic drug and electrolyte in the same time. It's used mostly or usually in our emergency department for control the blood pressure, to lower the level of the blood pressure, and also for magnesium, to replace the magnesium if the magnesium have hypomagnesemia. It's also used in the seizures, prevent for preeclampsia and eclampsia. Also, it's used and very common in the asthma exacerbations, moderate up to severe. So the using of the magnesium sulfates is a lot in the emergency department, but now we are going to speak about how we will use it as a pain for pain management and as an analgesia, not as a antiarrhythmic or as electrolyte. But we need to speak about the side effects of the magnesium sulfate, because any drug we are going to use in the emergency department, we need to know also that there is a side effect we need to take care of, and to understand that this could be happened if we will use this or prescribe this medication. So actually, there's a lot of complications, or let it be side effects, that can be associated with using the magnesium sulfate: flushing, drowsiness, hypotension, sometimes pulmonary edema, hyperkalemia, cold feeling, anxiety, confusion, and weakness. Although it's like the percentage facing this side effects, maybe it's not that high, but we need to take care that there's many side effects that we may face if we are going to use the magnesium sulfate. So the history of the magnesium sulfate as a pain management has proven successfully in managing pain before and after surgery, and this was using in the operating room in the OR before and after surgery. And the first prescription was from the side of anesthesia. The anesthesiologist used this before for managing the pain before and after surgery. However, this drug has primarily been used for pain control in patients undergoing surgery also. So within the surgery, before and after, and within the surgery, the anesthesia was recommended, and giving this medication, magnesium sulfate, for pain control in the OT during the surgery, before and after the surgery also. So if we want to speak about this medication in the OT, the analgesic dose was, the low dose was 50 milligram per kg in 100 milliliter of normal saline over 15 to 30 minutes. So this was the dose that was using by the anesthesiologist at the OT, at the operating room, so operating theater. So this was the first time that was using of magnesium sulfate as a pain management or pain control in the OT during the surgery, before and after also. If we want to go for the literature review about the magnesium sulfate, actually there's many literature review, and they used it before. There was a paper was published in 2019 November, having like intravenous magnesium sulfate to treat acute headache in emergency department, and the conclusion was very good, that after 1 hour there was resolving of the pain and also the aura duration by using the magnesium sulfate. This was publishing in 2019 November. If we want to go for another one, we have also a magnesium sulfate for pain. It was in 2021. It was also for a total article 315, identified 226 were discarded, but actually they were having also a pain reduction by visual analog scale, the VAS scale, 0 to 10. There was also 0 pain scale after using the magnesium sulfate, which was magnificent, and it was a very good outcome from the magnesium sulfate medication in the emergency department. So actually it's not a new, it's since maybe 2019 until now. Many researches, many paper was published for the using of magnesium sulfate in emergency department and in pain control in different setting. According to our case report, we are based this podcast for a case report that happened in 2022 in Al Shifa Medical Complex in Gaza. I did it before. This was the first time that we're using the magnesium sulfate in emergency department, and it was a renal colic case. I used it for this case for the first time, and I was recorded this case and published it in a local journal here in Gaza, and it was actually a very good outcome. We are going now to speak about this case. for pain management with magnesium sulfate in emergency department of Al Shifa Medical Complex. Our case is a male patient, 29 years old, not known to have any chronic medical illness. Presented to our emergency department at 5 p.m. with severe left flank pain. And I was remembering that it was 9 out of 10 in a pain scale. Started 15 minutes before his presentation to the ED. His pain was very colicky and radiated to the lower abdomen. He had similar attacks 2 years ago, undiagnosed as a case of renal calculi, a renal stone. He was not having any history of allergy or past surgical history, no family history of hereditary disease. He was healthy with no chronic medical illness. And his examination was the patient is conscious, oriented, agitated, and shouting from pain. I remember that very well. He was shouting, and he needs directly a need for pain management or pain control. His vital signs was within normal, 140 blood pressure, saturation 99 on a room air, heart rate was 115, and temperature was 37.5. And all his examination, chest, abdomen was normal. IV axis was already inserted and blood sample were withdrawn. So our first decision was to kill the pain. We need a painkiller. So we started the non-steroidal as diclofenac sodium ampoule 50 milligram IM, in addition with paracetamol IV 1 gram. We reassessed the patient after 1 hour later, and he was still in pain, like between 7 and 8 out of 10 according to the pain scale. Unfortunately, at that time, there was no opioid at our department. There was a shortage of opioid in our department, and we cannot bring opioid to give the patient. Because of that, we were having a limited resources at that time in the opioid, and we don't have except non-steroidal and paracetamol to give, and we already gave, and there was no significant changing in his pain scale. He's still in pain. So because of that, we need to think out of the box, and we should see another option to submit for this patient. So because of that, we think about magnesium sulfate. As I read this articles before and the using of magnesium sulfate, so I was encouraged to give this patient under monitoring the magnesium sulfate. So we monitored the patient, we gave magnesium sulfate for this patient, as this is our choice, 3 grams in 500 cc normal saline over 30 minutes. This was the dose that I used for this patient in the emergency department at that time, 3 gram in 500 cc normal saline over 30 minutes. So we monitored the patient, and we observed within 20 minutes of the administration of magnesium sulfate, the patient pain was dramatically reduced, and this was actually a surprising for me. It was 4 out of 10. After 40 minutes, the patient was totally out of pain. The pain was resolved, and he was monitoring for 1 more hour at the department, and his vital signs were within normal range, and no side effects were recorded. So the patient later on was discharged at 8 p.m. after underwent for his routine exam, lab and imaging, diagnosed for renal calculi. It was a ureteric stone, and treatment was given with follow-up appointment in the outpatient clinic for urology. And he was discharged with no pain. This was marvelous, and this was actually a very good result, and I was very happy for using for the first time magnesium sulfate in the emergency department, and we got this result. It was marvelous. I remember it very well. So the conclusion for me was the magnesium sulfate can be used as a pain management at emergency department in acute pain. So this was a very good choice if you are having a lack of opioids, or you have a limited resources in the emergency department, as we are in Gaza, and sometimes, most of the times, we have some shortage in medications, especially the painkiller medication. So because of that, we were going for another options, which was magnesium sulfate. We used it, and it was very good result that we cannot imagine even. So it was very good. But in the same time, our recommendation was we need more studies and researches inside Gaza about this issue under supervision of a qualified consultant, emergency medicine and anesthesiology, to make a paper and publishing this and to monitoring the giving of magnesium sulfate for pain management, and as we can put it in our local guidelines for emergency department in Gaza mainly. And as I read many researches, even newly researches, that magnesium sulfate is one of the options that you can use in the emergency department for pain management, and almost it's variable, and that you can easily prescribe it if the patient is fit for this medication. So pain, you need to search our message at the end. We need to search for any option to reduce the pain for the patient, because the first rule for our emergency department, and as we are emergency medicine doctors, we need to make the patient with no pain. No pain for the patient makes you work comfortably, and also makes you assist the patient in a good way, easily, without any barriers, without any difficulties. So the pain is our target is no pain, painkiller. As you need to reduce the pain, this is the target, but in the same time, you need to also make the patient feeling comfortable while he's in the setting of emergency department, to let the doctors do their job for assessment and for the for assessment and for searching for the reason or the cause of the pain for this patient. So because of that, don't stuck in one medication. Search out of the box. Search for other options to make your patient comfortable without pain. This was a small message. It was a small podcast for us for the pain. If we want to speak about pain more, we were going to have many episodes, but just we need to focus about the out-of-the-box thinking for the pain management and other agents, rather than the non-steroidals and the paracetamol and also the opioids, especially in a low resources settings. So because of that, this was our conclusion, and this was our message. Thank you for listening, and inshallah we will meet in other podcasts very soon. Ramadan Kareem, and goodbye.